The sequential event in the heart which is cyclically repeated is called the cardiac cycle, and it consists of systole and diastole of both the atria and ventricles. As mentioned earlier, the heart beats 72 times per minute. That is, many cardiac cycles are performed per minute. Actually, 72 cardiac cycle per minute. The cardiac cycles begins with the all the four chambers of heart are in a relaxed state. That is, they are in joint diastole. As the tricuspid and bicuspid valves are open, blood from the pulmonary veins and vena cava flows into the left and right ventricles respectively through the left and right atria. The semilunar valves are closed at this stage. The SA node now generates an action potential which stimulates both the atria to undergo a simultaneous contraction, the atrial systole. This increases the flow of blood into the ventricles by about 30%. The action potential is conducted to ventricular side by the AV node and the AV bundle, from where the bundle of His transmits it through the entire ventricular musculature. This causes the ventricular muscles to contract, that is ventricular systole. The atria undergoes relaxation, diastole, coinciding with the ventricular systole. The ventricular systole increases the ventricular pressures, causing the closure of tricuspid and bicuspid valves due to the attempted backflow of blood into the atria. As the ventricular pressure increases further, the semilunar valves guarding the pulmonary artery right side and the aorta left sides are forced open, allowing the blood in the ventricles to flow through these vessels into the circulatory pathways. The ventricular now relax ventricular diastole and the ventricular pressures falls, causing the closure of semilunar valves, which prevents the backflow of blood into the ventricles. As the ventricular pressure declines further, the tricuspid and bicuspid valves are pushed open by the pressure in the atria exerted by the blood which was being imparted into them by the veins. The blood now once again moves freely to the ventricles. The ventricles are and atria are now again in a relaxed, that is joint diastole state. As earlier, soon the SA node generates a new action potential and the events described above are repeated in that sequence and the process continues. In the cardiac output, during a cardiac cycles, each ventricle pumps out approx 70 ml of blood, which is called the stroke volume. The stroke volume multiplied by the heart rate, that is number of beats per minute, gives the cardiac output. Therefore, the cardiac outputs can be defined as the volume of blood pumped out by each ventricles per minute, and average 5 liter in a healthy individual. The body has ability to alter the stroke volume as well as the heart rate and thereby the cardiac output. For example, the cardiac output of an athlete will be much higher than that of the ordinary man. During each cardiac cycles, two prominent sounds are produced which can be easily heard through a stethoscope. The first sound, that is love, is associated with the closure of the tricuspid and bicuspid valves, whereas the second sound, dove, is associated with the closure of the semilunar valves. Heart, normal activities of the heart are regulated intrinsically, that is auto-regulated by the specialized muscles called nodal tissues. Hence, the heart is called myogenic. A special neural center is the medulla oblongata, can moderate the cardiac functions through the autonomic nervous systems. Neural signal through the sympathetic nerves that is part of ANS, can increase the rate of heartbeat, the strength of ventricular contraction, and thereby the cardiac outputs. On the other hand, the parasympathetic neural signals, that is another component of automatic nervous systems, decreases the rate of heartbeats. Now we'll discuss the ECG. ECG, this electrocardiograph machine is used to obtain electrocardiogram, that is ECG. ECG is graphical representation of the electrical activity of the heart during a cardiac cycle. To obtain a standard ECG, a patient is connected to the machine with three electrical leads, one to each wrist and to the left ankle, that continuously monitor the heart activity. For a detailed evaluation of the heart functions, multiple leads are attached to the chest region. Each peak in the ECG is identified with a letter from P to T that corresponds to the specific electrical activity of the heart. The P wave represents the electrical excitation or depolarization of the atria, which leads to contraction of both the atria. The QRS complex represents the depolarization of the ventricles, which initiate the ventricular contraction. The contraction starts shortly after Q and makes the beginning of the systoles. The T wave represents the return of the ventricles from the excited to normal state, that is repolarization. The end of T wave marks the end of systole. Obviously, by counting the number of QRS complex that occur in a given time period, one can determine the heartbeat rate of an individual. Since the ECG obtained from the different individuals have roughly the same shape for a given lead configurations, any deviation from this shape indicates a possible abnormality or disease. Hence, it is called greater significance. Now, what is blood pressure? The force that blood exerts against the wall of the vessel is called the blood pressure. The pressure of blood inside the arteries during the ventricular systole or contraction is called systolic pressure, and the pressure in the artery during ventricular diastole, that is relaxation, is called diastolic pressure. The normal systolic pressure is about 120 mmHg and diastolic pressure is 80 mmHg. Blood pressure is measured with an instrument called the sphygmomanometer. High blood pressure is also called hypertension. A contraction is caused by the contraction of arterioles, which result in increased resistance to the blood flow. It can lead to the rupture of an artery and internal bleedings. Hypertension of the term for blood pressures that is higher than the normal 120/80 in this measurement. 120 mmHg is the systolic and 80 is the diastolic. So resulting, if next is the coronary artery disease. Coronary artery disease, often referred to as the atherosclerosis, affects the vessels that supply blood to the heart muscles. It is caused by the deposit of calcium, fat, cholesterol, and fibrous tissues, which makes the lumen of the arteries narrower. Angina, it is the angina pectoris, a symptom of acute chest pain, appears when no enough oxygen is reaching the heart muscles. Angina can occur in men and women of any age, but it is more common among the middle-aged and elderly. It occurs due to the condition that affect the blood flow. Heart failure means the state of heart when it is not pumping blood effectively enough to meet the needs of the body. It is sometimes called the congestive heart failure because congestion of the lungs is one of the main symptom of this disease. Heart failure is not same as cardiac arrest. Cardiac arrest is when the heart stops beating, or a heart attack when the heart muscle is suddenly damaged by an individual by an inadequate blood flow. So this is congestion of lung and this disease and this is the different type of disease and coronary arteries and heart diseases. So thank you very much. Have a good day.